Hi guys, a few days ago a local reporter in the city of Bristol recorded a video of perhaps 100 people queuing along a street in order to book an appointment for an NHS dentist. The nearest alternative is about 50 miles away. The reason for the shortage is due to underfunding and a terrible contract that dentists have with the NHS. It's no longer feasible for them to operate within NHS England, and many have been forced to offer their services privately. We've already heard horror stories about people extracting their own teeth with pliers because they can't afford private treatment. So you would think that the Tory government would realise this and sort it out. Of course not. Now, Victoria Atkins, the Health Secretary, was asked about funding cuts and she refused to acknowledge the reality of the situation. Have a listen to this.
Am I right in thinking that actually the budget for NHS dentistry has dropped by £500 million since 2014. So you might be putting in an extra 200 million, but that's from a point where their budget is hugely smaller than it was 10 years ago.
So a lot has happened since 2014, but
the budget's dropped, hasn't it?
We have our budget is £3 billion. As I say, that is a lot of money,
which is lower than it was.
Indeed, last year we put out a ring fence around that funding, and some areas, in fairness to them, some areas took on that challenge and said, well, OK, if we don't have NHS dentists working to the top of their contracts, then we will innovate. And indeed, some of the dental vans that I'm talking about bringing in, there are already dental vans operating in, for example, Cornwall and Birmingham and other areas to try.
So instead of actually giving NHS dentists a better contract and investing more, she's talking about vans, dental vans.
Try and really help those parts of the country where people are struggling to get appointments. So this is about very practical measures that we have seen work already. We want to spread it out across the country so that from pregnant mums through to adulthood, we have a plan to help people not only smile for life if they're children, but also get that help that they need if they're adults.
Just to bring you back one more time, is the budget lower than it was?
So the budget is £3 billion.
But is that lower than it was?
As I say, we are spending more on the NHS than we ever have. That is, that is a.
But is it lower than it was?
Well, it's a £3 billion budget.
So is it lower?
And a lot has happened in those 10 years that you're talking about. But as I say, this is additional money, an additional £200 million on top of the £3 billion.
Additional after a budget cut.
It's a little bit rich for Labour to be lecturing us when they're proposed.
Who mentioned Labour? She's been asked a number of times. How many times? 3 times? 4 times? The budget is lower than 2014. And she won't answer the question, which obviously means, yes, it is lower, because if it wasn't lower, she'd say, no, it's not lower, it's actually higher. But obviously she can't answer the question because she'd have to admit reality, yes, the budget is lower. So there are people extracting their teeth at the moment because they can't get an NHS dentist. And instead of actually dealing with this problem, her solution is, we're actually going to cut the budget for NHS dentists and we're going to issue a number of vans.
Would only provide 700,000 appointments. We have gone the extra mile because we want to turbocharge this, and we are offering 2.5 million more appointments with a long-term plan for the dentistry workforce.
To be fair,
the way we get round this,
Victoria Atkins, it's not Labour asking you these questions, it's me.
All right, well, but you've just quoted West Streeting to me, so I'm responding to.
She didn't quote West Streeting. What the hell is wrong with you? But even if she was quoting West Streeting, you're talking about what you're going to do in the future. There are people extracting their teeth now. There are people queuing around a block to get an NHS appointment, NHS dentist appointment. Why are they doing that? Because there are no dentists in the area. They'd have to travel 50 frigging miles, in this case in Bristol. 50 miles. Now, not everyone has a car. They'd have to rely on public transport. And it would take ages to get to the next dentist. How is that acceptable? How is that reasonable? And at the same time, instead of investing more, you're cutting it. Less money than 10 years ago. They talk about, well, there's, 500 million here, 300 million there. But when it came to Rwanda, for example, there was no concern about throwing money at that problem. But when it comes to actually looking after citizens, No, we need to cut public services. We need to reduce the size of the government. We need to innovate. Let's try some vans. Let's try and convince dentists to take on more patients instead of actually giving them a better contract. The dentists have been saying this has been a problem for years. This isn't something new. This has been constantly a problem for NHS dentists. They say, look, this contract that we have, it's not feasible. We can't operate within it. We have massive costs. Remember, inflation affects ordinary people, but it also affects dentists. The cost of their material is up. So if the government are not giving them a better contract, they're going to have to rely on the private sector. And this is not a criticism of NHS, of the dentists who are no longer NHS dentists, because they have to survive. They have to pay their bills. They have to pay their staff. They need, in order to pay the bills, they need to work in the private sector. And now some people can afford to rely on the private sector. People can afford private treatment, but not everyone can. And that's why you're hearing stories about people waiting for ages to get an NHS dentist appointment, and if they don't get it in time, they're resorting to homemade measures. But notice she wouldn't answer the question. She wouldn't say, yes, we've actually cut funding, because then she'd be in a bit of a fix. Let me know in the comment section, guys, what you think. As always, your comments are greatly appreciated. Thanks a lot.